put out that he was going to go to.
Hello again, everyone. Welcome to the respiratory chapter. In this video lecture, we'll give you some overview of the respiratory chapter and cover other critical items as you learn how to code respiratory disorders. Again, we're coding diseases and disorders of the respiratory system, so hopefully we'll take a look at some of these disorders. All the codes begin with the letter J, J0 through J99. And we'll talk a little bit about the why of all of these. So you can see the basic organization, and it covers acute respiratory infections, J00 through 06, J09 through J18, flus and pneumonias, J20 through J22, other acute lower respiratory infections, J30 through 39, diseases of the upper respiratory tract, chronic lower respiratory diseases, and J60 through 70, lung diseases due to external, agents. All right, now we're back on track. J80 through 84, of course, diseases affecting the interstitium. J85 through 86, suppurative necrotic conditions of the lower respiratory tract. J90 through 94, diseases of the pleura. J95, intraoperative and post-procedural complications. And then, of course, J96 through 99, other diseases of the respiratory system. And again, a lot of providers, particularly pulmonologists, intensivists, like this because the codes are designed reflecting their current terminology, right? J43 emphysema talks about the typical panlobular emphysema, centriolobular emphysema. Again, this is the one chapter where if you just kind of stop reading at a fine level of detail, when you see the term emphysema, you're going to be penalized. If you read things closer, you will be rewarded. Asthma is similar. One thing about asthma that is a little bit different is it can be intermittent, mild persistent, moderate persistent, and severe persistent. So again, once you see the main term of asthma, look for the qualifying terms and read carefully. A lot of instructional notes. It may be worth your time to review the guidelines in the beginning of this chapter. And if a respiratory condition is described as occurring in more than one site and is not specifically indexed, it should be classified to the lower anatomic site. And here's an example of it. Tracheobronchitis is classified to bronchitis in J40 and not bronchitis, not specified as acute or chronic. Another reminder, we covered health status codes, and a lot of these you'll see instructional notes that ask you to code exposure to environmental tobacco smoke, exposure to tobacco smoke in the perinatal period, history of tobacco dependence, occupational exposures, dependence, and use of tobacco. Most of their games airing on Fox 13 Plus. Had to get the plug in there for Fox 13 Plus. So again, covering the organization of it, here's some more of these notes. And if you think about it, this is consistent with some of the other things we've covered. You read in the tabular, use additional code to identify infectious agents. It's very similar to what we did with coding infectious diseases. Use additional code to identify the virus. Code associated lung abscesses, code underlying diseases. By this point in the course, these should be very familiar to you. And ICD-10-CM has specific chapter guidelines for acute exacerbation, meaning that these conditions of COPD, bronchitis, asthma, and so on are getting worse. So look for those terms. Acute respiratory failure can be used as either a principal or a secondary diagnosis, right? And again, this goes back to our definition of what a principal diagnosis is. It is the condition that's established after study for the reason that the patient was admitted. And again, that is dependent on the documentation, and these are the general coding guidelines. Influenza that's due to a certain identified influenza virus, of course, we're going to identify that virus and code it. There's also ventilator-associated pneumonia and vaping-related disorders. And again, some new codes on these as well. Right now, if they don't win, I don't even want to think about it. We're having completely different upper respiratory infections, J00 through 6. We start with those, and these are things that are in the sinuses, the nose, tonsils, larynx, trachea. And again, use additional codes to identify the infectious agent, like we did in coding infectious diseases. These are your strep, your staph, your bacterial and viral organisms. And there's a great diagram, 13.1, that's in your text, similar to what I'm going to be posting on Canvas. So you might want to take a quick review of that. Influenza, falling in code categories J09 through J11, acute viral infection of the respiratory tract, and it's classified according to what type of flu virus and what kind of conditions, right? And it can either be certain identified influenza viruses, it could be other identified, or it could be unidentified, right? And so if it's identified, it wouldn't fall in a code of J11, right? So those are the kind of things that you may want to keep in mind as you work your way through coding some of these. And here's an example. We talked about earlier, J09 code categories are influenza due to certain identified influenza viruses. Here it is. Novel influenza A virus, flu A, J09.X. Right, so these are the avian flus, and these are becoming more and more of an issue if you've been following these things in the news, right? And the specifics, there's specific codes in the J09 code category that identify whether the virus is present with pneumonia, other manifestations, or GI manifestations. So really important to get these right. And J10, here's another identified influenza virus, flu virus, a swine origin, the famous swine flu outbreak that some of you may remember back in 2009. Right? Usually on the other side of it. Yeah. And likewise, within that code category, we see specific characters that will identify when it occurs with pneumonia, other respiratory, GI, or other manifestations. And of course, J10, right? J10.8, flu with respiratory and GI manifestations, myocarditis, all these different types of things. And I would encourage you to take a look at your tabular and look at some of the specifics of these J10 codes, starting from 0 to J10.8. Okay, as we move on, we're going to get into some of these things about pneumonia. Pneumonia is something that is a big cause of concern. And the codes will identify both the underlying organisms and the site within the lung, right? So we can see some of the code categories here: viral pneumonia, pneumonia due to strep, bacterial pneumonia not other elsewhere classified, and so on. And then we even have pneumonia unspecified organisms. So of course, most common is viral pneumonia, falling into code category J12. This primarily affects the trachea and the bronchi within the lungs. Could be any of these viruses here. I'm not going to dwell on COVID. We covered that in an earlier chapter, but just keep that in mind as you work your way through these. Again, I just did a little reminder about it. We only use these J12.8 codes when we're talking specifically about pneumonia due to coronavirus, right? The J1282 is saying it's pneumonia due to COVID. That's different than other different types of pneumonia. And again, how you find that, you find it on the main terms of pneumonia and COVID-19. Pneumonia may also be due to bacterial infections, such as Streptococcus pneumoniae, the J13. And again, this can be documented as bronchopneumonia. It could involve the pleura, excuse me. If it's associated with influenza, there's a code first note to code the associated influenza. If this gets bad enough, it can develop into a lung abscess. And then, of course, that would be coded first, again, due to the tabular. And we can have pneumonia due to Haemophilus influenzae, J14. This is another bacterial pneumonia. And again, we see this again. If a condition occurs with the lung abscess, we code also the lung abscess. These are right there in the tabular, another reason to stay on top of this. And of course, we could have pneumonia due to other infectious organisms. We would code first the associated influenza if it's applicable, and also any abscess. We can even get pneumonia in diseases classified elsewhere. And if we see these codes listed in italics, it means it can't be listed as the first code or just by itself as a single code. We would code the underlying infection, meaning the Q fever, rheumatic fever, or schistosomiasis. No need to worry. He is okay. And again, we can have unspecified pneumonia. Typically, these are lower in the lungs, so bronchopneumonia, lobar pneumonia, hypostatic pneumonia, or some of these other terms. And now we get into our bronchitis. Bronchitis, of course, is inflammation of the bronchi, and this can be an acute or chronic. Acute bronchitis is the inflammation, usually the less severe form of the condition. Chronic bronchitis is associated to prolonged exposure to irritants. A lot of times this could be industrial or perhaps cigarette smoking. We don't close. In acute bronchitis, again, one of the things we want to look at is to look at the causative organism. And you can see some of these. The mycoplasma, the strep. That's always our go-to, right? Parainfluenza, RSV. And again, the key here is to read the documentation closely. Tell us if in fact you're okay from that snowball. Everything all right back there? And acute bronchiolitis is similar to bronchitis, except it's affecting the bronchioles. It's caused by a viral infection. And we see a lot of these in young infants under a year old. And again, you can see the different types of specific codes based on the virus. And of course, we have other specified and unspecified. Here are some other diseases of the upper respiratory tract that are coded to these code categories. These include vasomotor, allergic rhinitis. I'm not going to read through all these. You can do those. But again, these are things, if you use the alphabetic index, look for the main term, and then drill down, you should be able to find these.
Now we're going to step away for a 2-minute break.
And again, chronic bronchitis, main term bronchitis, subterm chronic is how you would find these codes that fall into code categories J40 through 42. These are associated with prolonged exposure to these irritants, and a lot of times that is cigarette smoking. J40 is for bronchitis not specified as acute or chronic. J41 is covering the codes for simple and mucopurulent chronic bronchitis. Emphysema is a very common condition caused, and it's a specific type of chronic obstructive pulmonary disease. Right. And with this, we have abnormal permanent enlargement of air spaces down to the terminal bronchioles with destruction of the alveoli. Emphysema often occurs with chronic bronchitis. And the two main types are centriacinar, centriolobular, and pancinar or panlobular. And last slide here is more of the different subtypes of emphysema. We can have unilateral pulmonary, panlobular, centrilobular, other emphysema. And then if you just see emphysema with no other qualification, it would get the unspecified code of J43.9.
Come back to live now from Fox that we're following a severe.
That's all I have for you. Come back and we'll finish our lecture on coding diseases and disorders of the respiratory system. Thank you for watching.